Uh-oh, guess what day it is? Guess what day it is? Huh? Mike. What day is it, Mike?
Mike. Oh, hey, I'm Michael Andrew Weston, and welcome back to Hump Day Health Talk. I don't know if you know, but we just had what's called a Men's Health Summit 2025. And over the next few weeks, we're going to be sharing the conversations from that summit. Today, you're going to be hearing from the panel on financial stability and community well-being. Take a listen.
So today's panel discussion is about financial stability and community well-being. But first, I'm gonna allow them 30 seconds to do a brief introduction about them, their background, as well as some different questions before we get into that. Good morning, everyone. Hi, great. Again, my name is Cosmo. I am a financial advisor with Equitable Advisors. That organization's been around since 1859. And what I primarily focus on is helping individuals minimize their overall risk while obtaining gains in their investments and insurance portfolios.
Good morning, everyone. My name is Derrick, Howell. I come in kind of a dual affiliation today, Chief Financial Officer for Care Alliance Health Center, but then also Principal Consultant with Ascend Financial Consulting, which is a Chicago-based but nationally licensed financial consulting firm. And I primarily focus on making sure that people of color, people in underserved communities and marginalized communities have the financial literacy and resources they need to live healthy and successful lives. And so just proud to be here with you today.
My name is Mordecai Cargill. I'm the co-founder and chief creative officer for Third Space. Third Space Action Labs, a grassroots solution studio. I'm also the co-owner, co-founder of Third Space Reading Room, which is Cleveland's very own Black Radical Imagination bookstore, live on 105.
First, we'll start off with Cosmo. How does financial stability impact overall community well-being, and what role do financial institutions play in fostering financial stability?
So I'll start off with the hard question, right? All right. So when you think about financial stability and the impacts on health, you really got to look at some statistics. And based on the CDC, 50% of Black men aged 20 and older have hypertension. And 38% have obesity. When it's time for you to obtain some protection through appropriate life insurance, your cost of insurance is going to be higher. And because your cost of insurance is higher, then you may not even qualify for appropriate insurance. And it impacts your loved ones, your lineage, because you have the inability to hand off something to that next generation. So increasing your financial literacy and your financial aptitude is also part of that whole process. There's some CFP principles around budgeting, and we call that the 50-30-20 rule. Can y'all say 50-30-20 with me? All right, 50-30-20. What does that really mean? It means that 50% of your overall net income should cover your household needs and your living expenses. 30% of that income should cover what you consider your wants. And then the other 20% should cover, one, planning for retirement, your emergency savings, and then any additional major, debt reduction strategies. So you focus on laying a solid foundation of budgeting, and then also making sure you're focused on your healthcare with some preventative activities, exercising, eating right, and having resources within your community, such as a garden, fresh fruit. Those also reduce the statistics around hypertension and also diabetes and obesity, which correlate.
What strategies can be employed to improve financial literacy and education, and how can we make these resources more accessible to the general public?
Thank you for that. No, I think that's a great question, and it's actually right in alignment with the bulk of what I do in my study. We literally sit down and talk with people about educating them on the financial principles, 50-30-20 rule of 72, making, all of these different things that can really impact our financial well-being that 9 times out of 10 we're not getting in schools. In fact, as I did my study and started interviewing with multiple people, the only individuals in the population that had financial literacy knowledge indicated that it did not come from schools, it didn't come from anywhere else, but 9 times out of 10, it came from their parents. And so when you think about that, if our parents don't have the information and their parents didn't have the information, where do we get it from? So I think we need to do a better job. Number one, partnering with our schools, partnering with other educational institutions to make sure that we can bring the knowledge, those of us that have it, to these underserved communities. And then events just like this are what we have to do to make sure that we can get the information out there.